My profession is one that deals with young people. And most young people, because of their innocence, they are normally cheerful. They normally hold this smile, this grin that makes you feel like there's something to smile about, there's something to grin about. So they bring the smile out of me. They give me the drive. I would like to meet them. I can't wait to go to class. I can't wait to be with them, because at the end of each class, I feel so relieved. It's like I've just taken an aspirin.
In a secondary school in the west of Nairobi, a CRE class is on. These are Form 1 students and they're all ears. It's an interactive class and today's topic has to do with matters of the Bible.
God is everywhere. Yes, another. He's an orderly God.
For 46-year-old Rose Onsando, this is what she does best. She's eager to deliver her part by instilling knowledge in these youngsters. It is her investment into their future.
She's determined with what she's doing. She loves her work. The class is very cooperative.
Despite her enthusiasm, deep down her heart is a burden. She's only just learning to shoulder one that has confined her to a wheelchair. Images frozen in time, happier times, moments to be cherished. At 25 and with a degree in her hands, she was ready to conquer the world. But what started as a normal fatigue and persistent body pains later turned into something else.
It took a long time for me to know that what the problem was, because I kept on going from one doctor to another, feeling unwell, just explaining how I felt, my discomfort.
After several consultations and hospital visits, the hour of reckoning finally came.
He explained to me that I have rheumatoid arthritis as a disease.
This was just the beginning of what was to turn out as a long battle with a strange disease.
The idea that there's no cure was very, very, very disturbing and very destructive.
Rose Onsando has been living with rheumatoid arthritis for the last 22 years, a disease that literally eats away the bones.
Once I was diagnosed with the disease, the destruction started almost immediately. The bone structure started deteriorating. I could no longer walk, the muscles loosened up, the joints loosened up, and I started limping. Then from the limp, I started helping myself with a walking stick. Then the walking stick was not doing a good job. I started using crutches. Then after some time, the crutches were not helping me at all. I started using now the wheelchair.
Bernadette, who is in her late 50s, has found herself back to the full-time duty of being a mother, nursing her 30-year-old firstborn daughter, Cecilia.
I feel labor pain, fresh, as if I'm giving birth to her again. And it's very painful. It's painful because I cannot help her. I've tried my best, but I'm unable to.
The disease struck while she was still in high school at a very tender age.
So when my dad passed away, it was the shock triggered it, made it worse. So in the next couple of years, okay, it wasn't that bad. Then in 1998, my right knee just started getting deformed.
Her condition has since deteriorated, leading to this.
The pain is, I can't even explain. It's very intense, as in it's like your two bones crashing. So the friction makes it very, very, very painful.
Now, the only person who is carrying that responsibility has also fallen victim to the relatively rare complication.
My knees pain, my joints, like my fingers, but mine is not to the extreme. It has not reached to where has reached.
Somewhere in Kahawa West on the outskirts of Nairobi, another patient. This is the farthest Viola can go outside her aunt's house. The weather has not been kind of late, but today there is some sunshine. She too cannot walk. She was diagnosed with the disease while still in her teens.
Because I used to feel slight pain. When I go to school, when I come back, it's like I have to take a hot shower. Or sometimes I do a lot of resting, It's like it doesn't want me to walk for very long distances. I didn't realize about the disease first.
Now 27 years, she had already completed her education and was teaching computer studies in Eton, Eldoret.
When I fell down now, I went for treatment, and after that I was just, I was confined down, and it's like I could not go back for work.
The weather in Eton could not favor her and she had to relocate to Nairobi. Rheumatoid arthritis is a chronic inflammation that leads to the destruction of the cartilage, bone and ligaments, causing deformity of the joints. It can happen to anyone and develop at any age, but most commonly starts in middle adult life.
It is a problem where there's a disorder of the immune system. The body's immune system just go berserk and start fighting itself. The cause is not known. There is a lot of speculation whether it is caused by infections, whether it is caused by diet, whether it is caused by certain environmental activities.
The common symptoms are pain and stiffness of affected joints. Most commonly affected are the small joints of the fingers, thumbs, wrist, feet and ankles.
The disease can be very aggressive in some patients and very indolent in others.
So all my joints were corroded and eaten away, and the muscles had really loosened up, and other joints had fused. So he recommended surgery, and I started my surgeries in 1985.
My knees started swelling. They swell in the morning. I wake up very stiff. Walking is a problem.
The kind of inflammation occasioned by the disease can damage the cartilage, which may become eroded or worn out. The bone underneath may become thinned.
Symmetrical arthritis affects both sides of the body. If the right hand is affected, it's going to affect the left hand. And it damages the joint, and sometimes the chemicals produced by the body can dissolve some of the bones. And coupled with disuse, the hand is not used, and therefore the muscles start wasting. So that's what makes the hands to be tiny, to become crooked, because there's a dissolution of the bones.
I'm told my cartilage is worn out. I practically have no cartilage.
The amount of disability which develops usually depends on how much damage is done over time to the affected joints.
I have multiple dislocation of my hands. That's the elbows are dislocated. The wrists are corroded. Some of the finger joints are fused, and others are dislocated. But the good news is, it's possible for surgery to be done, and I will get a new elbow, a new wrist, new finger joints.
Basic activities that most people take for granted, such as sleeping, bathing, getting dressed, suddenly become extremely challenging. There is no known cure for the disease, but doctors recommend medication to ease the pain.
Control the disease using disease-modifying drugs, which are many. Right now, if a patient comes early for treatment, we are able to control the disease and the patient can lead normal lives without any damage of the joints.
I must always be in an anti-inflammatory drug. Then I must always be in a painkiller. Then I must have a remittent drug. A remittent drug is that relieves you of the pain for a longer period. Anti-inflammatory is to lower the inflammation that is permanent, part and parcel of the disease.
The pain, you cannot say, It's like when you don't take the painkiller, you are off. You can't even concentrate.
In most cases, they'll give you painkillers. We tried some herbals, which helped. But after some time, the body gets used to it.
You know, I've coped with it. It's like it's in me. I cannot remove it, you see. So I have to accept it for me to continue going on with life.
Rheumatoid arthritis reduces your lifespan by 10 years. So if you are meant to live, for example, 80 years, rheumatoid arthritis and its complication will reduce your life by 10 years. So it doesn't really kill.
The disability comes from the fact that you're in so much pain that you limit your movements. So anytime you're moving, it's like you fix yourself in a certain position so that in case you feel pain, not so much.
The pain in the joints, it's like, what can I use now? The pain you cannot say, you know. It's like when you don't take the painkiller, you're off. You can't even concentrate.
Once you are sick with rheumatoid arthritis, routine medication is the only way to control pain, swelling, and sustained damage of the joints.
The drugs that the patient takes range from number one, we have the non-steroidal anti-inflammatory drugs. These are the drugs that we use for controlling the pain and the swelling of the joints. These do not alter the disease function, but they make the patient feel comfortable. Because if the patient does not feel comfortable, he will not go to the other drugs which will act a bit slowly. Then we have steroids like prednisone. This has got both roles. It is a very effective anti-inflammatory drug, and if a patient comes with severe pain, this is a drug of choice so that the pain can settle completely. Then it also has a role in modifying the disease, but it has got many other side effects, so we try to use it at low dosages and we don't want to use it for a long period of time. Then among the disease modifying drugs, which we even have available in Kenya, we have, for example, a drug like methotrexate, which is very convenient. The patient takes the drug once a week, and it is one of the drugs which has been proven to work very well and for a long period of time and can actually modify the disease.
Occasionally, surgery will be needed to correct severely affected joints. Surgeries relieve joint pain and enhance functionality.
The muscles start wasting. So that's what makes the hands to be tiny, to become crooked, because there's a dissolution of the bones, of the joints, and there's imbalance of the forces of the tendons across the joint. And what happened is that these are patients who either were not diagnosed early, or if they were diagnosed early, they were not put on appropriate and effective treatment. And even if they were put, they did not stay on treatment. However, the improvement in treatment has been within the last 10 years. So those who caught it a bit earlier may not have benefited as much as the patients who are being diagnosed now.
Rose has already undergone 8 surgeries, but more will be needed.
For me to do the hip replacement, I had to buy a hip, which cost me 100,000, and then the hip is replaced. How they go about it is that the arthritis normally sucks off the synovial fluid. Then it goes to the synovial membrane and tears it apart. Then goes to the tendons.